So taping for lateral elbow pain. If you've seen the taping for trigger points, you'll definitely be familiar with this taping technique. So once again, this is probably just a bit of a revision for those of you that aren't familiar with the taping technique. So what we're doing here is we're offloading the site of pain, but we're going to stabilise along the length of the muscle as well. So first point of call is that the extensors need to be in a stretched position, like so, like that. And we might just put a little bit of pronation there. So pull off the end, that's going to be your anchor. So just above the wrist is the area that we're going to go. You can almost use the ulnar condyle as your landmark. And peel the backing tape off, like so. Now we're going to go along the length of the extensors, and we want to end up past the elbow itself. Okay, like so. So remember, there's no stretch on the end, about 30 or 40% stretch on the rest of it. Okay, like so. Give it a rub, that helps activate the adhesive, and then we've got our decompression strip, which is going to go over the side of pain. So if you're still not sure of the side of your pain, get them to make a fist, obviously a bit of resisted extension, and you should be able to pick up wherever they feel the pain. So for most people, it'll be in and around that area, like there. Okay, so what we'll do is that we will tape directly over that area. Okay, so this decompression needs to be on roughly about 80 or 90, like so. Okay, peel off the ends, like so, and you're done. Okay, so very, very simply, it's just a matter of put it on a stretch, stabilizing 30-40%, okay, no stretch on the ends, pull it over about 80 or 90, once again no stretch, over the side of pain. Really quite simple.